Friends, welcome back to a deep dive into TMJ and TMD. And in case you missed it, on the first part of this series, we really explored all of the various symptoms, both known and lesser known symptoms of TMJ, TMD. We took a deep dive with Dr. T into her own personal story. And on today's show, we're going to go into the unique way that we treat and approach solving and fixing this very complicated issue. Welcome back, everybody. It's another episode of Your Mouth Matters. I'm here with Dr. T, and today we're taking a deep dive into treatment of TMJ and TMD. But first, Dr. T, let's do a quick recap on some of the symptoms, some of the high-level stuff people should be aware of with TMJ, TMD, in case they missed our first episode, our first exploration of this.
Yeah, totally. I'm excited to be here. If you listen to the one before this, you will know that this is a really important topic to me. I have my own personal story with TMJ issues and migraine headaches that I had when I was a kid. A lot of people come in to the dental offices and they come in usually because they have a cavity or they want to make sure that their gum recession is under control or they have some bad breath or something. A lot of people don't realize the symptoms that are linked with our bite. In dentistry, in dental school, they teach us that there are 3 diseases in dentistry. There's 3 main diseases. One disease is cavities. So cavities. The second disease is periodontal disease. That's like bone loss, recession. Your teeth can get wiggly and fall out if you have gum disease. And then the third one, which is really not talked about much, and it's really not even talked much about it in dental school either, is occlusal disease. And occlusal disease means that there's dysfunction in the bite, the way that your teeth come together. And that could be from orthodontic treatment, right? If we're moving teeth and we're creating a new bite, that can cause trauma, that can cause symptoms. We also could have our teeth or our kids comes in and maybe there's crooked or maybe one tooth comes in a little behind or whatever. And that puts different cranial strain on our bodies and that can cause symptoms. And like I said, a lot of people are coming into the dental office with cavities or periodontal concerns, and they may have headaches and migraines and neck pain and see a chiropractor and just think, oh, my back is just always tight or my neck is always tight. And they may not put the connection together that actually could be an occlusal issue, a bite issue, which would be that third dental disease that I'm talking about. So just to recap, I think that my experience with patients is that a lot of people have symptoms that they don't even know are linked, could potentially be linked to their bite. So one of the big ones is headaches. Headaches are really common in patients that have TMJ issues. Obviously, if you have any jaw joint pain, there's pain in the joint. There's pain. The jaw joint is right in front of the ears. So if you're getting pain in front of your ears, that's a sign that you might have some TMJ issues. If you hear clicking and popping, that means that your jaw is not functioning properly. It means that the jaw joint is actually not on the disc that it's supposed to be on. So that can be an issue with dysfunction. Again, we have to ask, why is that joint popping off of that disc? And typically that's because of position of the jaw, and the position of the jaw is dictated by the bite. If you can't open your mouth very wide, you should be able, we talked about this last podcast, you should be able to put 3 or 4 fingers in your mouth. If you can't do that, then you have limited jaw opening. That could be another sign that there's some jaw joint dysfunction. Ear pain is another one. Ear congestion. If you're getting ear infections all the time, that could be linked with your bite and your jaw position. Vertigo, another big one. Tinnitus is also a big red flag for TMJ issues. And with tinnitus patients, it's really interesting because if you move your jaw forward and you can change that tinnitus, that's a really good indicator that's actually coming from the jaw. Difficulty swallowing, clenching and grinding, those are also big ones. How many patients have been told by their dentist, hey, have some teeth where I think you clench and grind your teeth. You need a night guard. That's most people, right? And so most people are like, yeah, I have some where I clench and grind. But the dentists usually don't take the next step into talking about why. Why are you clenching and grinding? Why is that happening? Why are you wearing the teeth down? And then coming up with a treatment plan to actually fix that. A lot of people just say, oh, I clench. And it's, let's have you clench on a mouth guard instead of, you can chew on this plastic instead of your teeth and then you won't wear your teeth down. But we really still haven't fixed the problem. A night guard is still just such a Band-Aid. If you have sensitive teeth or you have recession, if you have recession in some teeth and you're like, I don't know why I'm getting this recession. If it's on just a couple of teeth, that could be a sign that I only get it on my back molars. In the front, it's fine. Or I only get in the front and not the back. those are signs that there could be a bite issue going on. If you have upper cervical neck pain, that is huge. I can't tell you how many patients go to the chiropractor religiously and they feel better, but then it comes back. And some of my patients have been seeing chiropractor for over a decade, every week or two, because they have neck pain. And if you're a chiropractor, sometimes there is issues with the neck, and that really is the reason why you have pain. But if you're going to that chiropractor every week or two and that pain's not getting better in a more permanent way, you're not making good progress, then we really have to look at that bite, because the facial muscles and the jaw muscles are all connected to the upper cervical spine. They're almost the same, right? So that's why chiropractic and jaw stuff is so linked together. If you have forward head posture, that's another sign. If you take a picture from the side, you'll see that they're actually gazing up a little bit. That head is tilted forward. Well, that's a sign that there's not enough support in the back teeth. So that's an occlusal, a bite issue. If you have numbness in your fingertips, that's another sign. If you have facial asymmetry, if you notice that your face is not symmetrical, that could be a bite issue. If you don't like the way your profile looks, if you see that lower jaw is positioned back and you're just like, I don't like photos taken from the side, I just don't have that strong jaw, that's a sign of a TMJ issue or a bite issue. Also, swelling in the face. If you snore or you don't sleep really well, or you have sleep apnea, that could be another sign that you might have some jaw issues going on. So that list is really long. They even have linked estrogen issues and hormone issues with TMJ issues and thyroid issues with TMJ. So it's a very long list. If you interview people and you ask them about all of those things, usually most people are going to say, yes, they definitely have some of those things. It's always great to look into that bite and find out how much is that bite affecting your symptoms. And again, that's not really something that most dentists are trained to do, because in dental school, we're really taught to just make night guards. And we talk a little bit about occlusion and bite, but it's just not, we don't go deep into that. Right? So I've gone through just many hours of continuing education, trained with many different kind of experts in the field. And I feel very confident now in treating patients that have TMJ and bite issues. That list is pretty long. And of course, some people may not feel like they get a headache maybe once every couple of months. So it may not be strong enough to where you're like, yeah, I really need to treat this, right? So patients that I treat and I see typically are in a lot of pain. These symptoms change their quality of life. They're missing work. They're missing school. They have so much pain. They can't function. I had a woman a few weeks ago who was planning to go to Amsterdam with her daughter. And she said, my jaw pain is so bad, I'm thinking about canceling my trip. So she's going to cancel her entire trip to fly to Europe and have this amazing experience with her daughter because of her jaw pain. So I'm like, oh my gosh, no, we got to get you feeling better so you can go see Amsterdam with your daughter and have those amazing memories. So when we treat TMJ patients, again, just if you're like, oh, I have a headache once a month or whatever, if it's not debilitating, then jumping into a treatment may not be right for you. But if you really want to be proactive with your health, if it changes your quality of life, those symptoms are affecting your quality of life, then it's really worth it to take a look into that bite more thoroughly. In our office, we obviously screen people. We talk about symptoms. We do our muscle palpation and everything. And typically with jaw issues, with patients that have a lot of symptoms, the jaw is not in the right position. And usually the jaw is positioned back. So that jaw is more back than we want it to be. The TMJ joint is really interesting because the bone, the mandible, which is the lower jaw, it crosses the midline. So you've got two joints on both sides and one bone that connects. And so you can't open your mouth without affecting both sides, right? So if there's a problem in one joint, that's going to affect the other joint as well. It's not like a leg where this knee is bad, right? Because we don't have a bone that goes all the way from one knee around and there's all this articulation. The mandible is this really unique structure in the body, and that makes it harder to treat. And also, there's a lot of proprioception in our teeth. You can feel a tenth of a millimeter with your teeth. That's how sensitive that proprioception is. And when we bite down, all of that proprioception goes up to our brain and it helps us orient in space where we are. And so that proprioception, because it's so sensitive, micro tiny adjustments in the bite or changes in the occlusion can really cause irritation. And so this is why those TMJ issues are linked with all of those other symptoms, because it just takes a tenth of a millimeter for that to create irritation in your muscles and in your jaw. And there's really no other place in the body that is as sensitive. Like if you step on a human hair, you're not going to feel that. But if you bite on a human hair, you're going to feel that. So it's like we have different levels of sensitivity and proprioception. When we're treating TMJ and jaw issues, we have to be really specific and really detail oriented. And we have to slow down and make sure we're doing it right. Because if we just slap a night guard in there, that could make it worse. If we don't really balance everything out and make sure that the muscles and the joint and all of those things are happy. When we identify that a patient has TMJ issues, we do really thorough diagnostics. I want to know what's going on. Why does this patient have this issue? Is the jaw joint off of the disc? Are the muscles on one side overworked and the ones on the other side are not working at all? Do we have deflection, or is when we open the jaw, does it go to one side? And what does that mean? And so we use what's called a K7, and we do EMGs basically on all of the muscles. We do them on the neck muscles. We do them on the jaw muscles. And that gives me an idea as to how healthy the muscles are when we start. Okay, this is our baseline. Most people that have symptoms, their muscles are going to be not working right. They're going to be really angry, or they're going to be over fatigued. And maybe the certain muscles that are supposed to be working are not going to be working. And then other muscles are going to have to compensate for those muscles not working and take over and run the show. And that's going to, again, cause symptoms. So again, all of what we do is about proper function, right? We want to establish proper function, which means that certain muscles should be working and certain muscles should not be working. And we have to really, part of our treatment goal needs to be to try to help stabilize those muscles, because 90% of the symptoms and pain that we get comes from the muscles. Okay. The jaw joint, the bone, there's not very many nerves in there. So that the pain doesn't typically come from the bone, but if the bone is positioned in back or in a weird way, that's going to pull on the muscles, and the irritation in the muscles is what's going to cause the symptoms. So we really have to focus on those muscles and make sure they're happy. And when you bite your teeth down on your natural teeth, when you bite down, your muscles don't really get to run the show. Your bite gets to run the show. Your teeth come together in a certain way so you can chew your food. And enamel's really strong, stronger than bone. And so every time you're going to bite down, it's survival, right? We got to eat our food. So your muscles are going to have to accommodate, and they're the ones that have to give up their happiness to make sure that the teeth come together. So this is really important to remember, because we have to, again, back up and go, why are the symptoms happening? It's probably muscle related. And so the scans and the EMGs that I do show me what's happening on that deeper level. Okay. So I do those baseline. That gives me a really good idea. If I see a lot of activity in the upper cervical group in the spine, then I know, you know what, this person probably going to need to have chiropractic done alongside this treatment for them to get the best results. And not just any kind of chiropractic, right? It's got to be like cranial base, SOT, NUCA, like upper cervical chiropractic is typically the best. So we do the EMGs, and then I actually have this piece of it's very sensitive, and we put a magnet on the front teeth, and it actually allows me to see your jaw in space and where it is. And so the next question is, okay, if we took the teeth out of the head completely and we asked the muscles where they want to be, where would the jaw live in space in relationship to the top jaw? And the question to that is, I have no idea. I use ULF10s to help me figure out where that position is. And ULF10s puts a little microcurrent into the muscles, and it helps bring all of those muscles, those sarcomeres, the muscle cells to like their physiologically rested position. It brings blood flow into the muscles. And so if you have a muscle that's really overworked, overtired, or a muscle that's really irritated, that TENS is going to help break that up and remove the proprioception from that muscle. Okay. It also is going to help remove that proprioception of your bite, because we're biting and chewing, and we're very aware of where our teeth are. And if you go bite into an apple, you don't think about it. It's part of who we are. It's part of that proprioception just woven into us. So we have to remove that, because we don't want the old bite to interfere with the new bite and the position of the jaw. We use TENS to help figure out, to relax the muscles. And then I have patients go through several activities, stretches and different exercises to really help stretch and optimize the muscle position. And I have them do that with the TENS machine on. And then we use that jaw tracker that I was talking about. So I can see your jaw in 3 dimensions. I can see what your muscles are doing with the EMGs. I can see where your jaw is in space in relationship to your top teeth and your top jaw. And I can see exactly where your jaw wants to live. So I mark that spot on my computer and then we go find that spot and we capture that position with our bite registration. So this is all very hard to explain without visual aids. Usually I have a lot of visual aids and it's so much easier to explain if you come in for a consultation. But I think the point is obviously what I'm talking about is so much more than just making a night guard, right? This is so much more precise and it's really science-based and it makes sense, right? That's what we do, make sense dentistry.
Yeah, I think that stands out, I think, to your point, and I just want to emphasize what you just said. You took us through 7-8 minute kind of deep dive explanation of the process that you're using just to go through and assess what's actually happening, where the jaw should be, understanding the nuance. And it really did a great job of helping us understand why it's so important to take that step. And it's just such a contrast with you need a night guard and it's like a 30-second conversation.
And they don't do any
none of that
analysis of where should the jaw be, where are the muscles. And this is why a lot of people, they chew through their night guards or the night guards cause them to have issues. In fact, there was a study that came out that showed that upper night guards actually make snoring and sleep apnea worse. And when we just start blindly putting things in without really knowing what we're doing or understanding the muscles and the functionality, we run the risk of actually making things worse. And sometimes a dentist might get lucky. If you have a night guard and you love it and it stops your clutching, great. That dentist just by chance happened to find your perfect jaw position, right? And some people, they have really wide goalposts, right? Like you can kick a ball and it's like, it doesn't matter as long as you kick it, like it's going to go in the post, right? Like some people are not that sensitive, but other people have really narrow goalposts and you have to be so precise. So when you're working with a pain patient, you're working with a patient that has symptoms. Usually those people they have the goalposts smaller, right? Like the reason that they have symptoms because they're hypersensitive and they're very, like if one little thing is off, then it throws them off. So we have to be detail oriented and have intention behind where we're positioning the jaw. And then the interesting thing is that I see a lot of patients that have jaw orthotics made. Even if they've gone through all this with a different dentist, they will come in with their appliance. They still have symptoms. So after you get the appliance, and the appliance, by the way, is a removable appliance that goes on the bottom only. It looks like teeth and it feels like you can actually chew with this in. A lot of our patients do because they have so much pain that they take the appliance out. They get pain when they chew. If you don't spend the time to really make sure that orthotics that you just put in someone's mouth is really dialed in to work functionally and relieve certain muscle groups when you move your jaw in certain positions, then you aren't necessarily going to get rid of the symptoms. So part of this is figuring out where the jaw belongs optimally. What's the optimal trajectory of the jaw? And then the second part is once you get that orthotic, the doctor has to be competent and be able to dial in the microocclusion so that the jaw can move around freely so that there is proper function. Because what happens is when there's interferences in our bite, if we move our jaw from side to side and certain teeth are grinding on one another, that's going to cause a lot of cranial strain. And when the muscles aren't happy, that's when we get symptoms. So you have to make sure that you design your orthotic in a way to where when the patient is functioning, when they're chewing, when they're sleeping, you have to make sure that when they're doing those things, that it's actually making the muscles less irritated and not more irritated. And so a lot of times I see, even with doctors that treat TMJ issues, patients that come in with these orthotics, and none of these classic principles, these occlusal principles are taken into consideration. Yes, your jaw might be happy if it's in a certain position and my EMGs might look really good when you're just sitting there. But when you start moving your jaw around, what happens to those muscles, right? And so that's a piece that a lot of dentists, they don't really take that into account. They just take into account like, oh yeah, the bite looks good. Tab feels good. Okay, great. And I spend about 3 hours adjusting my orthotics because I can't simulate in any way how your jaw moves. No lab can know how your jaw moves, right? Is it symmetrical? Is it the way that you chew on one side versus the other side? It's different. Are you missing a tooth here? Is it too sensitive over here? I don't know how you chew, right? And no lab and no AI right now can really track that. And so what happens is that you have to come in and you have to be my articulator. You have to chew on it and you have to show me how you chew. And then I take that the client's that the lab has made, and I make all these adjustments to it. And a lot of patients are like, oh, man, like, is this normal? Like that? And it is. It's really normal because I cannot simulate to the lab how you move your jaw. And everybody's different. Some people, they can barely move their jaw to the right side, but they can move their jaw really far to the left. Well, that's going to change the way that bite has to work because of the range of motion. So anyways, it's a very technical procedure. And a lot of times what happens is when we put people in orthotics, I usually will have patients, after I do that dialing in of the bite and get it the best that I can, I will have them wear it for a week. And you want to wear it all the time because we're trying to take this new jaw position out for a test drive. So the minute you take your appliance out and you go eat a sandwich, now all that cranial strain from before is back. And so your symptoms may not be relieved unless we really give it a good go and let those muscles relax and give those muscles the space so that they can relax. Because if you're constantly taking that appliance in and out, you're just shifting these muscles and pushing them around. They're going from being relaxed to now irritated and relaxed and irritated. And so to do this treatment the right way, you really have to wear your orthotic almost 24/7. Like I said, a lot of my patients, will eat with it in. And then we know if your symptoms go away, and most of my patients see symptom relief in just a week. It's amazing. I always ask patients, like on a scale of 1 to 10, how bad's your pain? And I've had patients that have circled 10s, and then 1 week later, they're down to a 2. It's really incredible. That's incredible fast the jaw responds. It's life-changing. And so for a lot of people, you'll see that instant symptom relief. And some other people, it might take a little bit more time, but usually it's not like the symptoms get worse. It's usually not that. Usually the symptoms have gone down. Usually in just a week, we see improvement on most patients.
What's crazy about that too is that you've shared your story on one of the other episodes, and oftentimes these are problems that people have had for years, sometimes years and years of extreme issues that go away in a week. But it's like, why didn't I do this? I wish I would have known about this so long ago, right?
I know.
Going through all of that anguish, it's like, you could be a week away from relief.
Yeah, exactly. It's pretty incredible. And the symptom relief is great. It tells us how much is this jaw and bite related to my symptoms, right? And we can see that. Now, that doesn't mean that you're healed in a week because like you said, these issues have probably been building up. And this stems back from how your teeth came in, maybe orthodontic work you had, or some people have had teeth extracted and they had trauma. A lot of patients come in after wisdom teeth are out and they have jaw pain because the surgeon's cranking on their jaw and those muscles are really irritated. You have to wear this orthotic for a while to get full joint stability, right? We're trying to create stability in the joint. And sometimes, especially if we're trying to recapture a disc or there's a click or a pop or there's locking in the jaw, sometimes it takes longer because as we wear this, the muscles start to trust a little bit more and the muscles start to unwind. Yes, I use a TENS machine, but TENS doesn't always relax the muscles, right? It doesn't always relax the muscles exactly where I want them to be because again, these muscles have been chronically irritated and upset for years. By wearing the orthotic, that helps put the muscles out. And then as your joint heals and remodeled and the muscles relax, your jaw position is going to change. And so this is why you have to keep coming back to see me so I can adjust your appliance. Typically what happens is that when you leave, your bite is nice and even. The movements are nice and even. And then in a few months, I'll check and that bite will now be different. Usually what happens is the jaw typically wants to be more forward. As that jaw joint is decompressing and as that jaw is healing, that jaw will actually shift forward and we'll see that now you're biting only on the front teeth when your orthotic's in. And so I have to relieve this because if I want that jaw to continue healing and I want those muscles to continue to heal, I have to relieve that surface so that we can continue with that healing process and that stabilization. So that treatment takes time. You have to wear your orthotic and you have to come in. I usually see patients about every 2 to 3 months to check their orthotics. And I know that you're done when there's not really a lot of change anymore. So if I check your bite and you look the same as you did when you came in a couple months ago, I know, you know what? We're probably pretty stable. For things, a lot of patients are like, I have this orthotic. It's so great. My headaches are gone, but now what do I do? Do I have to wear this thing forever? And the answer is no. There's ways that you can fix that, but you always want to do this removable orthotic. We call it phase 1 treatment because nothing's permanent. And if you hate it or your symptoms get worse, you can take it out and you're good. And we did nothing permanent. Yes, you can do permanent changes, but you really want to make sure you test drive it first, because a lot of dentists will just jump into orthodontics without doing this first. And then after the braces come off, now there's symptoms. So we always want to create stability. We always want to figure out where that optimal jaw position is first, make sure people are happy, make sure people's symptoms aren't bad, and then we can build the teeth to that position. And we call that phase 2. Phase 2 is we either need to do orthodontics to move the teeth into that position, or we do restorative treatment. Restorative treatment means that we are making the teeth taller with porcelain. We're making those teeth actually taller. If you have crowns, we would replace those crowns to this new bite, this new level. We might need to do some orthodontics. If there's a lot of crowding or something, we might do some orthodontics, and then we would finish with some restorative work. So that's for people that are like, I love this. I want this to be my permanent bite. But there's also the opportunity, and I always give patients the opportunity to wean off of their appliance. So when we put the appliance in initially, you're wearing it all the time. And why do we do that? I explained. That's because every time you take it out, you're shifting back to your old bite. That's causing cranial torque, cranial strain. The muscles are irritated. And so we're trying to put a fire out. We want those muscles to just be chill. So wear the orthotic. Okay. Now, after your symptoms have gone down and your joints snap healed and your muscles are happier, some patients can wean off of the appliance. And what that means is that they stop wearing it during the day. They'll stop wearing it for a few hours. Okay. How's it going? Are your symptoms coming back, or are they good? They're good. Okay, great. Now try another hour with it out. I had a patient who came in with migraines. He was getting migraines like every day, and it was affecting his quality of life a lot and has had them for years. And we did an orthotic. And in the beginning, he's like, I haven't had a headache for a few weeks now. And it was like, oh, great. That's awesome. And then eventually he's like, I haven't had a headache in months. Great. This is working. We like this. Your headaches, we know now, are from your jaw. We have figured this out. And you had a removable appliance. So I said, after he had no headaches for a while, I'm like, okay, what I want you to do is try to wean off of this. So stop wearing it for a few hours during the day. So he stopped wearing it, and he said, my headaches came back. So I'm like, okay, too fast. Let's wear it more. And so we gave it another few months. And then I'm like, okay, let's try weaning you off again. So he tried, and eventually he went to just nighttime wear, and his headaches have stayed gone. So sometimes you can wean people off, and you don't have to do the orthodontics and the restorative work and all of that to fix the bite. But other times you might wean off and it just doesn't work. Your headaches come back, your neck pain comes back, your symptoms are coming back. If that's the case, then we really have to figure out a phase 2 option and how to stabilize you so that you don't have to wear a removable appliance in your mouth for the rest of your life, right? And like I said, that can be, there's options. There's orthodontics. We also can make fixed orthotics, which are actually like orthotics that are glued onto the teeth. So that's an option. And then there's also the option of doing restorative, and then a combination of all of these. A lot of patients, when they start, they want to jump to that phase 2 treatment. They want to know, what's my phase 2? What am I doing? And the answer is, I just don't know, because I don't know if you're going to be able to wean off your appliance. And I don't know where that jaw is going to end. The position of the jaw is changing throughout treatment. So when we get to the end of the treatment, where's that jaw? And then if that jaw is like really forward, but the top jaw is backed out, then we probably need orthodontics. But I don't always know how that jaw is where it's going to go. And so that's why it's hard for me to really tell people from the beginning when we start, what's my phase 2 going to be? What am I doing for phase 2? I usually say it really just depends on so many things. Now, if you come into my office because you have crowding and you have some issues, and you come in and you want orthodontics and you're like, I want orthodontics, I'm going to run through all of my screening. And if you have any TMJ issues or symptoms, I'm going to make you an orthotic first. Because I can't tell you how many people I see in my office that come in after the orthodontist did their treatment and now they have symptoms. They didn't have symptoms when they started, or maybe they had some, but the orthodontist didn't really screen for that. Orthodontists are amazing at moving teeth. That's what their specialty is. They move teeth. But they do not know much about the jaw joint and the muscle, where the jaw should be. They have very little, if no, training in that. The problem with that is that the bite and the way that the teeth come together and the position of everything is linked with the muscles and the jaw joint. It's really unfortunate that they're not trained in that, because they're over here doing this treatment that can cause these issues, but then they don't know how to fix them, and they don't know how to be aware of them when they go in, right? If you want to do orthodontics, we really want to stabilize that jaw first, figure out where that lower jaw wants to be. And then we develop our orthodontic plan around that happy muscle jaw position that we have found. And so that's what makes us a little different. It does make your treatment time longer because we have to stabilize your joint first, but you're going to end without symptoms and you're going to be optimizing your muscles. So many patients have these symptoms that, like I said, they don't even realize they're linked to their bites. So anyways, I just can't emphasize enough how important it is that you stabilize your joint before orthodontic treatment. People that are just jumping into Invisalign and they just want straight teeth. Invisalign is great, but it's not going to take into account where that jaw should be, right? So anyways, I'm very picky with my Invisalign patients, like when I will allow them to just straighten the teeth and because I'm always like, oh, like you might be one of those people that when we get done with you, you're going to have symptoms. So that's the process in our office. And we, like I said, I spend a lot of time with people dialing in the bite. And I think that's really unique. That's not something that most doctors do. And I've taken many classes in TMJ with different practitioners, different people that do different things. And I feel like the reason that I've done that is because I want to know it all. I want to know all of the different, I want to see it from everybody's different angle. And so I can then take all that information and come up with my protocol and figure out what works for me in my hands. And I've just found that there's few people that are teaching it as comprehensive as I want it to be. And so that's what's so awesome about what we do, because I'm able to blend it all together. And I work a lot with Dr. Jason Stappa. We've done other podcasts with him. He is a chiropractor and does SOT and cranial and specializes in TMJ treatment. We work a lot together. If you've seen me, I probably referred you to him, especially if you came in with jaw issues. That upper cervical spine and the cranium is so linked with the bite. Sometimes there's adjunct treatments, and it's ideal if you can see him or whoever the chiropractor you're working with before we find that optimal bite. And then when we deliver, and just as an adjunct, it's just a really beautiful combination treatment if you can do that. So anyways, we also have to screen for like mouth breathing and airway issues, because a lot of times jaw issues might happen because of an airway issue. If you're mouth breathing at nighttime, that's causing your jaw to fall back. And when that jaw is falling back, the muscles are irritated. A lot of people will clench and grind their teeth because their mouth is just open at nighttime. Doing simple things like mouth tape or looking at the turbinates, maybe seeing the ENT and having a turbinate reduction surgery, or figuring out why is there inflammation? Why can't I breathe through my nose? Maybe I have mold. Maybe there's mold in my house, and that's why I always have this low-grade sinus infection. But we really have to screen and make sure that the breathing is good, because in order to have proper function, the mouth needs to be closed. We need to be able to breathe through our nose, and that's going to help reposition that jaw joint and make those muscles not so angry as well. The jaw stuff, the airway stuff, it's all linked together as usual. It's linked with everything, right? You always laugh because it always comes back to airway and breathing. It's all based on function.
I think one of the things I'd call out here is that I think if you're listening through this and you're realizing like, hey, yeah, you need to come in, I think there's two kind of key ideas that we would call out. One is that this is something where it's worth taking the time on. Right? It's worth being patient. It's worth being comprehensive. It's worth the extra resources and time that it takes to get it right. Because if you just throw some stopgap solution in there, some Band-Aid solution or the quick fix, the chances are that it's not going to work, but it can make things worse, and you're going to be back to square one, or you're going to be in a worse position. So one is take the time to figure it out, right? Take the time, have that patience. And I think the other message is a great message of hope. It's like, you can solve it. This can be solved. Although it is complicated, although you have to be patient, there's a process that you've developed that can take a person from where they are now in a state of dysfunction and pain and discomfort and frustration. You can get them to a spot where we've created a lasting solution. But that path is going to be unique, and it's going to be personalized, and it's going to be individualized based on the uniqueness of that person's whole system, right? All the stuff we just talked about, everything you just took us through. So I think it's a really great message, but it's also one where I think as a patient, you have to recognize, okay, there's a process to go through.
It's a treatment. I think some people are like, that's a night guard. And you're like, that is so not a night guard. It is not a night guard. Trust me. Like, a night guard is just a piece of plastic you put in between your teeth at night. I see all these things on social media that are like, oh, your dentist is making all this money off of night guards when you can just do it yourself and order our kit and you'll do it yourself. And oh my gosh, that just terrifies me because I'm like, how do you know that you're helping and putting the jaw? And then if you have a problem, if you develop symptoms or headaches or you have neck pain or whatever, you can't turn your head anymore, there is nobody to come back to and be like, hey, can you help me fix this? Right. And then now you're stuck and you have to go find a dentist to undo all of that stuff that you did. It's the same with orthodontics. Like people are like, oh, I need to straighten my teeth. So they go through years of orthodontics. Braces, by the way, if you have had them, they suck. They suck, especially when you're an adult. Braces as an adult is horrible. Braces as a kid, also horrible, but more manageable. Somehow kids are way more adaptable than adults. But oh man, braces suck. If you go through years of orthodontic work and then you end up having all these symptoms because you didn't do any jaw stabilization before you got started, it's like, slow down, do it right. And yeah, this treatment that I do is a lot more expensive than a night guard. It's a lot more expensive, but we're really treating that root cause, right? We're like, I had a patient yesterday. She's like, I'm not clenching and grinding my teeth anymore. No, why is that? How could I possibly fix that? Because I got those muscles happy. Those muscles are not irritated. So there's no clenching and grinding anymore. We fixed the problem, right? So it's really, like I said, I love my visual aids because I think it helps so much, but this is a treatment. It is not here's your appointment, bye-bye. We'll see you at your next hygiene visit. This is a treatment where I'm committed to working with you, dialing it in. And like I said, sometimes we have to bring in other people like a chiropractor or a myofunctional therapist or maybe an ENT. I'm here to help figure it out with you, right? And I dig deep, and that's what we do at Green City Dental. We dig deep. I'm really passionate about that. So yeah, it's more expensive, but I think the outcome is so different than what you would get with just a plain old night guard. In fact, like I said, the plain old night guard can cause you to have more issues, which then we have to undo all of that. And when we have to undo things, it becomes harder, right? And you end up spending more money undoing things that you did with a dentist before. Yeah.
I think here's the thing. If you're listening and this is resonating or ringing a bell, or somebody in your life, as we've gone through this podcast, I have literally, over the last 2 episodes of recording this and going deep on this topic, I have thought of 4 or 5 people I'm going to forward this to because I know they have these symptoms. And in fact, I know they've gone to see chiropractors many times and all of this stuff where they get temporary relief, but it's not lasting. And so if you're listening to this and you're looking in the mirror and you're like, holy cow, this is me, pick up the phone, just put pause on the podcast is almost over. So go ahead and finish it. But then as soon as it's done, pick up the phone, call Green City, book your appointment, come in, right? Because you need to start the process. But if it's somebody in your life that forward this, make sure they're empowered. We understand and recognize that everyone's going to take action, but we want people to know they have an option and they have someone like Dr. T who's there as a resource to partner with them and do stuff that other places they just don't know how to do. Well, at Green City, we can help you, so if you have this issue, someone in your life has this issue, please share. We just want people to have the experience of feeling and living like they should be feeling and living, which is not in a state of pain or dysfunction or discomfort.
Yeah. And it's also not like getting your Botox injection for 2 masseters every few months, because first of all, that's really not fixing the underlying cause. And second, it's freaking expensive. If you have to do Botox in your jaw joints or in your muscles every 2 to 3 months for the rest of your life, you know how much money that is? So much money. So you should take that money and spend it on actually fixing the problem. And I'm not against Botox or anything. That's fine. It can definitely help you get out of pain. But if you think that's fixing your jaw, that's not fixing in a permanent way. You're going to be married to that Botox until you decide you don't want to do it or pay for it anymore. So let's just figure out what's going on. Fix the cause. Let's do it right the first time. And that's at least who I am. And got to figure this out. So anyways, yeah, if you have questions, I usually will if this very side of this resonates with you, I will typically bring you in for consultation first. We'll talk about all the things. We'll look at your jaw. We'll take a deeper dive and figure out what treatment's best for you. But I'm going to tell you 99% of the time, we're going to start with that removable orthotic because I want to know, I want you to test drive out a different bite And so that's usually always my phase 1 treatment. Phase 2 can be different. Like I said, there might not be even a phase 2, but if you can wean off. But that phase 2 treatment has a lot more flexibility. But typically, like I said, I'm always going to be making that orthotic as that first step. Yeah.
I love it. Well, Dr. T, thank you. As always, appreciate how deep we go on these topics. We go deeper than everybody else because we care more than everybody else. So thank you for being here. Thanks for sharing.
We're just more educated, Barry. I think that I wouldn't say people don't care. I think a lot of people don't push. Like, I'm always pushing for answers, right? I'm like, I'm going to go to another class. That wasn't comprehensive enough. I'm going to go to another one. And then I come back and I sit in my lab and figure out, how am I going to do this? So it takes a special type of personality.
That is true. You are obsessed with learning and going deeper and understanding why and always asking that follow-up question. Dr. T, thanks for your passion and your obsession around getting to the root cause. And as always, your mouth and your bite matter. We'll see you in the next episode.